Blood pressure assessment is a tool utilized by healthcare professionals to classify patients with high or low blood pressure. It functions by using the pressure exerted by circulating blood upon the walls of blood vessels. Hey, we're group 5. We're going to be going over how to properly assess blood pressure today. Make sure your patient has been seated quietly for the last 5 minutes, with their back supported, and their feet on the floor and their arms supported at heart level. The patient should have refrained from smoking cigarettes or ingesting caffeine for the last 30 minutes prior to the measurement.
Have you smoked or had any coffee within the last 30 minutes?
No.
Great.
Make sure the stethoscope is properly sterilized prior to use. The earpieces should also be facing forward, and that the stethoscope is adjusted so that you can hear the sound. Tap the diaphragm to confirm this.
Cuffs varies in size. There is small, regular, and adult size. Use appropriate cuff size according to your patient's arm. In this case, we will use the regular adult size.
You begin by placing the cuff around the upper left arm because the left arm is closest to the heart. This ensures that you hear the Korsakoff sounds clearly. The cuff is marked by an arrow that indicates the placement of the cuff at the brachial artery. Make sure that this arrow and the brachial artery align. Now place the diaphragm of the stethoscope at the brachial artery and pump the sphygmomanometer to about 160 to 180 millimeters of mercury, or 200 millimeters of mercury if needed. Once the cuff has reached 200 millimeters of mercury, release the air 2 to 5 millimeters of mercury per second. Listen closely to the first sound, which should indicate systolic blood pressure, and the continuation of lub-dub that follows. The last sound indicates diastolic blood pressure. At this point, completely release the air from the cuff and remove the cuff from the patient's arm.
This chart explains the different stages of blood pressure. A blood pressure reading of less than 120/80 indicates normotensive values. A reading between 120 and 139/80 and 89 indicates prehypertension, and a lifestyle change is required due to the risk of developing high blood pressure. Values higher than 180/110 are considered a hypertensive crisis and emergency care is needed.